Hi everyone, I'm Sital. I'm a maternity nurse, or a night nurse as you might like to call it, because I only do the nights. You might also find me under the name of Night Sister, which is my business name. Firstly, I just want to thank BabyBud Events for allowing me to share this short video with you and some of my top tips for newborns. Before I do, let me just tell you a little bit about myself. I'm mummy to 3 little girls, which has been gratifying, schooling and rewarding beyond words. I have a 20-year background in childcare and a passion for all things pregnancy, childbirth, breastfeeding and beyond. It's led me to my current position as a maternity nurse. I have been working as a maternity nurse for 7 years and it's served me well. So I might share some top tips with you in regards to not just sleep, because I know that's also a very important factor, but I know that somebody else has already shared some tips with you, some fantastic tips with you already. One of the things that I notice when I go into a new job with a newborn baby and mums are complaining that baby's not sleeping longer than a 1.5 hour stretch or 2 hour stretch. And I find that it's because they're not feeling secure enough usually. And swaddling is such an important factor when it comes to allowing babies to sleep a longer stretch in the night. And sometimes I go into a job and on the first night, mum and dad are very surprised that baby has slept a 4 or 5 hour stretch with me. And usually I have to point out that I start usually after the 2-week bonding period. It's not a must, but most of the time mums request me to come in after they have spent 2 weeks with their baby alone. So if your baby's brand new and you've had the very all-important special childbirth during this difficult time, I would say the first couple of weeks we do have to wake babies to feed them every 4 hours. But other than that, after a few weeks, and if they're gaining weight well, it's okay to let them stretch. Some of the other things that I might add is that if you are eager to breastfeed and it's something that you'd really like to do, then please do make sure you do your research so you don't come across any problems. And I know that when you have a screaming and hungry baby, it's so easy to just give in and that's okay. But if you've done your research beforehand and you've found the appropriate support, then you'll have a much more successful journey with breastfeeding. Lots of people talk about skin-to-skin contact, so that's one of my top tips as well, is that if you want to breastfeed, please make sure that in those early days you spend a lot of time doing skin-to-skin contact to make sure that you have enough of a milk supply. There's so many factors that go into an appropriate breast milk supply, but skin-to-skin is definitely one of them. Another thing I would like to stress is that it's so important for babies to have a good routine. It doesn't have to be a strict routine, I'm not going to say that it's a very strict routine, but it's just some simple steps that you could take, just so that baby knows what's coming next. And even at that age, they do really appreciate the routine. I recommend that people follow the easy routine, which I've found to work really well. So if you don't know about the easy routine, it works with the initials. So E is for eat. So baby obviously is either breastfeeding or bottle feeding. So that's the first part of the routine. The next part of the routine is activity. Now, when you're at the newborn stage, that is usually just feeding, which is also an activity. But the activity part of the routine needs to be age appropriate for your baby. So if your baby is very young, then usually the wake window is about 45 minutes to an hour. And I cover wake windows also on my Instagram feed. So if you'd like to take a look, please feel free to explore that on my page. Those wake windows then stretch longer and longer as your baby grows. So that's the activity part. Sometimes you just manage to feed and that's all. That's okay. Then after the activity is trying to create an appropriate sleep environment for your baby and allowing your baby to, have the right tools to get to sleep. So if this is a swaddle or a sleepy head you're using, or just rolled up towels around the Moses basket to keep them nice and cozy, knowing that they are in a safe environment to sleep in. Another important factor is how dark the room is. Sometimes it doesn't really matter at newborn stage, but especially at night it does make a difference. Leaving the TV on is one of the things that I don't recommend. Parents have worked with me for a long time, and on their night they could be watching TV in the background and wonder why baby's waking up every 2 hours. So I don't recommend that you have the TV on in the background at night, although it's very easy to do when you want some downtime. The next part of the routine is after sleep. So E is for eat, A is for activity, S is for sleep, and Y is for you time. It's so important, especially in the early days, if not throughout motherhood, to create some time for you. And it's a very difficult thing to do, to make time for just yourself. You do need to. It's so important to do this, to make some time for you. We talk about self-care, we talk about mental health, we talk about so many of these things, especially being Mental Health Week, maternal health this week. I think it's really important that we stress that it's time to just put your feet up. Don't worry about things that don't matter so much. Those early days, you don't need to have an amazing home. People understand that it's things that you struggle with during those early days. So make some time for you. So that's the easy routine. I could just quickly squeeze in the topic about dummies. I am a believer in dummies. I do feel like babies have such a strong moro reflex, like a sucking reflex, and they sometimes are looking for something just to comfort them. It's not, as long as it's used appropriately, it's not overused and it's not used too early, it's okay. Introducing a dummy should be done around 6 weeks post-birth, so 6 weeks of age. And I think it does help in a lot of ways. Another thing, I think that's it actually. I'm going to leave it at that so I don't go on and on. If you'd like any more information, please don't hesitate to contact me. Thank you again, BabyBud Events, for letting me share my video with you all. I hope you're all doing well in this crazy time that we're in and looking after yourselves. Thank you again. Bye-bye.